oh, oh, yeah. So, yeah. So,
Good morning. You are Mr. Hines who come to see me, is that right? Because
yes,
you're feeling a bit mentally ill.
yeah, I think it's Mr. Hines. Yeah, I think yeah.
Little mentally ill, is that right? Or very mentally ill, would you say?
Yes, I think
Obviously ideal with many mentally ill
yeah, I
people.
think just got to get the cup in the right place.
You have?
Second,
Oh, okay.
Yeah.
It's a bit OCD then.
Is it positioned correctly?
I'd say it's positioned adequately to diagnose you as an OCD patient with one of your symptoms. You probably have many, many others.
Well,
many others.
They say that I think I might be one of the 1 in 4.
One of the 1 in 4. So, pretty mentally ill. Pretty mentally ill.
At this point, yes. I mean, at this point, I'm just wondering, well, I've had these thoughts, and
you had these disturbed thoughts?
Yes, I've had these thoughts, and I think that.
Can I ask you what sort of disturbance has been there in your thoughts? Has it been sexual mainly, or has it been to do with demons, or something more abstract than that, perhaps a bit de-realisational?
Do you mind if I just move the ashtray away? Because that ashtray is causing severe distress.
If it helps you,
yeah,
please.
So I'm just going to move it over there.
Yes. Please don't pay attention to the hallucination over there. It looks like a cat. We have hallucinations.
Now, I've got a nice clear table now, so then I can start to talk to you about the ladies that keep standing at the bottom of my bed during the night.
So you have ladies...
all ages.
Just to get clear,
all ages.
You have ladies standing near your bottom at the end of the bed. Is that what happens? Near your bottom?
No. At the bottom of the bed.
Not near your bottom?
No, at the bottom.
Because it would be a different condition, obviously, if you had ladies standing near your bottom to if ladies are standing at the bottom of the bed. That would be a clear hallucination.
But that's rather inappropriate of you to say.
Well, I don't think this inappropriate comes into it, because I'm the psychiatrist and you are the nutter. To use the colloquial term.
Yes, I have mental health issues at the moment.
Very many mental health issues.
I had this... In the middle of the night, I'll wake up and there's ladies of all ages, about 5 to 10 of them standing at the bottom of the bed.
No.
And they're all looking at me, some of them looking at me seductively, some of them looking at me in a judgmental way, and some of them looking at me in a neutral way, and I can't make head or tail of it.
Right.
Well, they haven't got tails.
Right. No tails.
They've got heads.
Right.
But I can't make head or tail of this, and so I think there are mental health issues.
There are mental health issues. The question is, the ladies that are at the end of your bed, this is important because, again, diagnostically, it could be significant.
We're diagnosing.
Yes, I'm diagnosing. From the many conditions you could have schizophrenia.
Diagnosis?
Yes, you could have paranoid schizophrenia. You could be bipolar.
I think I'd rather give that a miss.
You could be have OCD or one of your conditions.
I'd rather give that a miss.
Yes, you could have chronic personality disorder, kind of things like that, all of which would require different kind of drugs and different kind of treatment regimes, which would vary from drugs to electricity passing through your body, to forms of poison.
I'd rather give those a miss.
Poison I would give you.
Else?
Poison I would give you, potentially.
Oh, right.
Yes, it's important to have poisons.
Is this a diagnosis or is this...
No, this is a diagnosis. We can give people poisons to cure them. Poisons.
But would you care to
elaborate
on the diagnosis?
Well, possibly. I need to know more about the conditions before I can give a diagnosis or a prognosis even. But I also need to say that
I can't make head or tail of these ladies.
No, you probably can't because they haven't got tails. But what I was going to say to you is that in days gone by.
Sorry, every so often I have this urge to.
I know I'm a very funny person. Yeah, very funny person I am. But what I was going to say to you is that in days gone by, if you had certain conditions, certain symptoms, you would have cut part of your brain out to make you better.
Right.
Yes,
that's another option that I would rather.
It's an option.
I'd rather give that option.
It's an option.
If you don't mind.
It's an option we can do privately, very privately.
What's that going to set me back?
Well, what I can do, I can send you to a shed. I'll be in there with an axe, and I will gently remove part of your brain that's necessary.
Gently.
Yes.
Right. Okay.
Yes. So
I don't drink alcohol, so I'm going to be completely with it.
Right.
Yeah.
Right.
You can see how with it I am, can't you?
Oh, I can see totally that you're with it in your own world.
Someone said to me the other day, "You're not all there." I said, "Well, I am definitely all there."
You're in your own world.
And what do they mean by there? Where's there?
Well, obviously the world that we see is the correct world, because obviously most people, when you get down to it, in today's world, I can diagnose most people as quite mentally ill.
Am I the 1 in 4? Or am I the 1 in 5,000?
Could be 1 in 4, possibly. But the key thing is that most...
The mainstream media, I've been told I need to watch the mainstream media more.
You have?
I don't watch the mainstream media.
As a diagnosis?
And I've been told by people you need to look at the mainstream media.
Yes.
They keep on about this mainstream media. I have no idea what it is. I'm told I need to look at the mainstream media more, and then I will be apparently more with it.
With it.
And at the moment I'm not all there, apparently, because I'm not watching the mainstream media.
With it isn't really a term that we psychiatrists like to use. We prefer to use... A little bit of mania there. I forgot to mention mania. Some mania, possibly.
Yes.
Manic laughter. That sort of thing. That's mania. See? Mania. Which means that you might become a maniac if we allowed you to. So we'd have to put you on some heavy emotional stabilizers to deal with that. I think you definitely...
Emotional stabilizers?
Yes, you definitely need emotional stabilizers, bring emotional stability. So what I'll do, if I give you a little injection...
I would like some stability.
Yes, I'll give you a little injection. There you go. No, wait a minute. It'll react. You'll go quite flat and very normal. Like most people, staggering around. You'll stagger around quite naturally and
I'll start watching the mainstream media.
Well, you may not be able to do anything else under this particular drug I've just given you, which is Largactil. Largactil. I've given you some...
Why do people keep talking about the mainstream media?
No, I've given you Largactil, and you will relax now.
Largactil.
Peaceful.
Largactil.
Yes, you will simply Recite the word.
Logactyl.
Yes, and now you should be feeling flat.
Logactyl.
I think if I can give you another little injection there in your buttocks, right, now it'll calm you down very, very quickly. You'll get very, very bland, very, very normal. You'll feel like staggering around.
What about
you want to put a mask on
what
your
about
face.
all the pork pies?
Pork pies.
I've seen so many of them all over the place.
That's a word, a phrase that I think you'd be using to describe your own eyes.
Pork pies.
Yes,
they resemble pork pies.
We can inject you in the eye if you like. It's a way we do produce this feeling of calm. We hold people down and we inject them in the eye.
So then it would look like a squashed pork pie.
Sort of like that, yes. Kind of like that.
Right, yeah.
But anyway.
Mind you, they're squashed anyway when they go in your mouth, aren't they?
Yes, they are. So, are you feeling a little bit better with the Largactyl now?
Largactyl.
I'd like to see a bit more calm.
Do you know, I'm in the zone with this Largactyl.
A little bit more calm. Think of calm. 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 Not calm.
I need to learn to do as you say.
Yes.
Don't I?
That's you need.
And I need to start to respect everything that you say because it's for the best.
You need to do that. Respect is a very, very.
I've been a little bit wayward, haven't I?
You have, yes. And of course, we psychiatrists.
Oh, sorry. Sorry, I just had to. I know this thing is supposed to get me in the zone and calm me down.
Yes, calm you down, right?
But I just needed to go and have a breather.
Yes. I need to tell you about we psychiatrists and our experience.
Because I know you're very kind people.
Yes, we're very kind.
Yes, yeah.
We've been dealing with nutters. And there's a lot of nutters around today.
I have mental health issues.
Well,
we
use the term nutter when the mental health issues have become severe, as in your case. I'll give you another injection.
Sorry, you have
another
to
injection.
I need bringing into line.
Yes, we do. Yes. So, we psychiatrists encounter nutters daily. In fact, walking down the street today, I would say 9 in 10 people I walk past should be in my psychiatric hospital.
And they need to be watching the mainstream media.
Possibly, but they should also be receiving a lot of injections. Possibly, quite a few of them should be receiving electricity through their body. And rather more than expected, should be having part of their brain removed, a lobotomy. And I'm working with my colleagues to bring back the lobotomy, because I think that if more people had part of their brain removed, they would become calm and compliant. They wouldn't be experiencing much life, but they'd be calm and compliant. And at the moment,
watching the BBC.
At the moment, I'm not going to recommend you for a lobotomy. But if you came back and started laughing manically again, I would be taking you out to the shed and giving you a small lobotomy. I'd emphasise small, and it will be done with little short chopping axe.
Because you have my best interests at heart,
yes.
Don't you? You're doing it for my own good.
Yes. I mean, obviously, one of the things that will happen when you're a little bit more recovered, more able to accept it, is you'll be receiving a small bill from me. Is that okay? Small bill.
Is this one of the bills they're putting through Parliament to deal with a 1 in 4?
It's rather similar to that.
Because I've heard there are bills going through Parliament, and I don't watch the mainstream media.
No.
But I was told that if I watch the mainstream media, it'll be the answer to all my problems.
It'll be the answer to all your prayers.
But I've heard on the internet they're putting a bill through Parliament to make sure that all the 1 in 4s like me are brought into line with the rest of society.
It's in fact closer to 1 in 1 at the moment, the number of mental patients that are around the country. 1 in 1.
Well, if you say that, it must be true.
It is true.
Because I totally, I'm putting myself in your hands.
It's totally true that the number of mental patients in the population has risen from 1 in 4 to close to 1 in 1. And if you were to smile at that again, I would have to give you another injection in your arse. You understand? You do understand, don't you? Yes.
I think I'll give that one a miss if you don't mind. But I mean, I do trust you, and I'm grateful for everything you're doing for me.
Of course, sometimes I need to bring in a few of the orderlies to hold you down while I gently and benevolently apply the injection. You understand? If you're too extreme, if your emotions are too unstable, there are all possibilities. So, I think you're stable enough now to be released on this occasion, but can I come back in a week's time when I may arrange for you to be locked up?
And it is in my own interest, I know.
It's in your own interest.
Because next time I see you, I need to talk to you about something, and I'm trusting you on this. I've been told I'm a conspiracy theorist.
That's very, very likely. Most of the 1 in 1 are conspiracy theorists. They are. And conspiracy theories are one of the things which can lead to full lobotomies.
Right, okay.
Full lobotomies. It's done in private.
Yeah.
In the small.
So I need to get a hold on this conspiracy theory.
You need to get a hold of yourself.
Yes.
Of yourself.
Yes.
Yes.
Oh, thank you.
Deal with your
I know everything
mental
you're doing is going to turn things around.
It will, undoubtedly. I have many years' experience in Germany.
I've been told that you do a lot of things very charitably.
I did quite a lot of work in Germany between 1939 and 45, and I also did a certain amount of work.
That age.
Well, the thing is, psychiatry is such a gentle profession. Your age.
Yes. Yeah.
And I also did some work in the Soviet Union during the period from 1953 to 1989, dealing with people who actually believed that there was something wrong with the system.
Yeah.
Today, people believe the same thing. The system is obviously quite right, quite sound.
Yes.
The mental patients are outside.
So you're going to drum this conspiracy theorist thing out of me, aren't you?
Yes. Thank you very much indeed, Mr. Hines.
Thank you so much.
Thank you.
Thank you.
Yes. Please keep well.
Yeah.
Yes.
Yeah.
And if you feel anything coming on, just take one of the little green pills and you'll become happy.
Oh yes, the green pills. Yeah. And what was the name of the other one?
The other one, Stellazine, is the one.
Stellazine. Stellazine. Oh, I'm so grateful for the Stellazine. Oh, so grateful.
Yeah, thank you, Mr. Hines. You can go to the door now and come back in a week's time and see me. Thank you.
Yes, thank you. Thank you very much. Thank you.
Goodbye.
Thank you. Thanks.
Yes.
I'm just getting started.